Our two panelists are from our very helpful sponsors who've been with us since we started these summits in New York in May. So we really appreciate the Trust and Epstein, Becker, and Green for being very supportive sponsors to us and sponsoring partly in the very helpful way of contributing very helpful content. So we're going to start with Jana Martin, who many of you know is the CEO of the Trust. She has a long background as a practicing psychologist, has held a lot of positions in organized psychology, president of the California Psych Association, etc. But she's going to tell you about risk management things to think about. We encourage psychologists to try these new things, try alternative practice models. But as we said in the way we titled this at the State Leadership Conference was, jump into new models with a good parachute. In other words, we want you to try these things, but we also want you to be aware of the risk management and legal issues that may come up. So Jana, take it away.
Thank you, Alan. Good morning, everybody. How are you? Good. So I don't want this to kind of start out with a framework of, oh my goodness, be afraid. I'm going to leave that to Kevin, the attorney. No, I'm just kidding. Really and truly, the whole point of this panel is to support you and to make sure that you go into alternative practice models with the right information so you can make the right decision so that you don't have to panic later. So it's more preventive than it is hopefully a scare tactic. So I'm hoping that you'll hear what I have to say in that kind of context. So clearly, alternative practice models offer a tremendous number of opportunities for psychologists. With that, because it's a new thing, that means that psychologists may have to do some things differently. And so before we start to do things differently, we have to make sure that we know how to do them correctly and that we protect our clients and patients, certainly, but that we also protect ourselves and our profession. That's really important. So we're going to cover very rapidly several areas. This is kind of to get your feet wet. What are some questions you need to begin formulating to ask yourself? It's not at all meant to be a crash course in risk management, and after hearing this 20 minutes, you are set. It means that what you'll be ready to do is to know what questions to ask and how to search out certain resources. So we know that with alternative practice models, we're looking at a lot of potential changes. You've already heard some of that in the conference so far. Electronic health records, maybe being co-located with other professionals, doing collaborative consultations, including different people in the mix, including sometimes insurance companies. And so with that comes a change perhaps from those of us who for many years practiced pretty much by ourselves. Maybe we had an office mate who rented office space. Maybe we were in a small group practice and we worked in our communities. And so Catherine and I are of the same kind of background in terms of the good old days. I love the way that she started that today. And so what we have to do is think about, well, what are the good new days and how do we make sure that we are prepared for all of that? So we're going to cover, again, as I said, somewhat quickly, some of these areas. What are some of the considerations that you need to be thinking about? We're going to talk about contracts and what you should know about contracts, but again, just in brief, certainly ethics and risk management, and then insurance. So we're not going to go over the practice models. You're all familiar with them. They were actually, some of the definitions were included in some of the previous slides, and you'll hear more about them. But it is important before you start thinking about, wow, is this something I really want to be a part of? It's good for you to know which one of these models actually fits you best, because we all fit differently into different kinds of models. So it's good to be familiar with them and to figure out which one might be the best fit for you. I think that one of the first things that we want you to think about is that before you enter into any kind of relationship, regardless of how simple it is or how complex it is, how small it is, or how big it is, what's your status going to be? Are you going to be an independent contractor or are you going to be an employee? Now that differentiation actually is much more important from a legal perspective for the employer than it is for you, because they can suffer some pretty serious consequences if they don't do it well. But I think for those of us who have been in independent practice and we haven't worked for somebody for a long time, we might have lost kind of the importance and the value of knowing the difference. So from a risk management perspective, it is important for you to make a conscious decision about which one do you want to be. So for example, you want to think about, if you're an independent contractor, what does that mean you get and you don't get? Well, one of the things that you lose is vacation time. But for a lot of us in practice, we didn't know what that was anyway, right? So it's important for us to think about, what about benefits? Independent contractors do not have benefits. They don't participate in health care plans. They don't participate in 401ks. They don't participate in any of those kinds of benefits. You are independent. It is very similar to what you're accustomed to in your independent practice. But what that also means is that you have the same risks that you do as an independent practitioner. So sometimes we find that people who go into agencies or alternative practice models might have the idea of, well, I'm a part of this group, so I can drop my individual policy, or I don't need my own personal coverage because the group is going to cover me. Not if you're an independent practitioner. Doesn't work that way. So that's an important difference for you to know in terms of how you take a look at all of that. In looking at your role as an employee, then what's really important is for you to think about, well, okay, I have this protection and I have all of these advantages of working in a setting where there are a lot of folks of different backgrounds who can really help inform my practice and my treatment decisions, and that's a tremendous advantage to belonging to an alternative practice model. But you may think in that case too, well, because I'm an employee, then I'm protected. I will tell you what we see a lot, and this is not casting aspersions on groups or agencies or companies, but a lot of times when a lawsuit is filed, a malpractice suit is filed, everybody gets named, the big pockets get the primary name, but then what happens is that if you're working for an agency or a company and it's because of something you did, that a suit is filed, that agency's primary concern is going to be you or them. Right, them. And so while you certainly will be covered, if you really want to make sure that you're not compromised and you're not made to settle on something that you don't think works for you as an individual, it's always good for you to make sure that you have your own advocate and your own defense coverage in that case. So one of the other advantages, certainly, of belonging to an alternative practice model, as I said, is having resources. But one of the questions you want to ask yourself is, what's your level of autonomy? Do you get to make your own treatment decisions, or does a group make that for you? It's very similar to decisions that you have to make, whether you do pay for service, fee for service, or whether you belong to a managed care or a preferred provider association or organization. So what level of autonomy do you have for your clients or patients? And what level of responsibility do you have with them? Because you can't ever really delegate that, and you'll hear me say that down the road as well. Some of the other advantages are efficiency. Most of us who have been in independent practice, and I was for over 25 years, we get, I'd say, bogged down with the paperwork. And wouldn't it be nice if somebody did that for us? Wouldn't it be nice if we didn't have to worry about some of those things? And that's one of the tremendous advantages of alternative practice models, depending on what they offer and what kind, and you'll hear about some of that this afternoon. So there really are those advantages, and certainly when you have colleagues, whether they're within the profession of psychology or outside of the profession of psychology, you can improve the quality of what you do by having more input and more information. But some of the drawbacks to you might be learning how to deal with less privacy. Electronic health records mean that, of course, when you're dealing with large groups, you're going to have other people sharing your notes, reading your notes, making sure that you manage your risk by knowing what needs to be included in the notes and what doesn't. And whether or not you might be influencing other decisions in a way that you don't really mean to be doing. I think that that's really important for you to be aware of as well. So, as we look at the impact of integration on the risk to the practitioner, we also want to look at some of the fact that you might be given many more complex cases than what you're accustomed to in your independent practice. Because a lot of these groups, as you've heard, contract with insurance companies and negotiate very good contracts with the insurance companies for higher rates of reimbursement, but with that comes perhaps a level of complexity of cases that you're not used to in your individual practice. It's important for you to ask questions like, how much say-so do I have over what cases I am given? How competent am I to provide services to these various diagnoses, and how can I improve my competence? Because of course we all can do that. This could be a wonderful learning time for us in terms of gaining more expertise in dealing with different cases. But you always have to know what your limit is. You always have to know what your level of expertise and competence is, because lack of competence is a prime area for malpractice suits as well as for board complaints. You also want to know about vicarious liability. I'm going to talk a little bit more about that, but we're seeing a lot of claims and board complaints related to vicarious liability. And what that means is that if you're this happens in group practices as well, not just alternative practice models, but you could be in a group practice or model in which someone else does something that's not quite okay, and a suit is filed or a complaint is filed. If you are in that group, you might be named too because you're a part of that group, and depending on how much of that group they discuss treatment team decisions, you could be named for that as well. So that's just something you need to think about that's a little different from necessarily being in totally by yourself in independent practice. But there's also decreased risk. That's always more fun to talk about. What's the decreased risk? Well, we've already talked a little bit about how you have access to so many other professionals and to perhaps medical services. Maybe it's not so hard to get that psychiatrist or that physician to call you back because they're down the hall and they can't avoid you very well in the bathroom. So it's really important to know that there are you might have access to a lot more crisis and emergency care services. You also can ask for advice or guidance. And many of these agencies or alternative models will have attorneys. Wow, that would be nice to have access to that group's attorney for questions that you might have instead of having to search for one on your own. So there are many areas of decreased risk in these models. I'm going to skip through that. Contracts. One of the things that a lot of us fail to do is read contracts. And I think it's really important to understand that that is our responsibility. And if you think, well, I'm not an attorney, I really don't understand all of this jargon, then you need to find someone who can help you with that. And I'm not suggesting for a moment that anyone would purposely deceive you in a contract or purposely manipulate things, but I tell you, when the time to hire an attorney to help you with a contract is before you sign it, not when you're in a mess. Because a lot of times we all know that words have different meanings for different people, and we can interpret things very differently from one person to the next. Well, no, I read that to mean this. Well, sorry, I didn't. Whoops, that could be a problem. So it's really important to make sure you understand these contracts. Pay particular attention to a couple of things. The services that you're agreeing to provide. Don't just assume that, hey, I get to do what I've always done. They may have something else in mind for you, and you may like it, but you just need to be aware of what it is. You also want to be clear about the financial terms. How are you paid? What are you paid for? Are there incentives involved as well? Are there things other than money that you're going to get? And if so, are sometimes do those replace financial betterment? And if so, does that work for you? If you get a 12-year subscription to Good Housekeeping magazine, is that going to replace an important amount of money that you might get paid? Probably not. So you want to look real carefully at what are those terms. What are other documents that might be incorporated by reference? For example, in a lot of contracts it says, and you will abide by the policies and procedures of so-and-so. Those need to be attached. You need to be able to read those. You need to make sure you understand. I can't tell you in my life outside of the trust when I was in practice how many times I read contracts that I was about to sign, and it said this is covered in Addendum A, and I'm going, okay, well, where's Addendum A? I don't know. I don't see Addendum A. Oh, we forgot to send that to you. Oh, well, thanks. So it's important to make sure Addendum A is really addended. You need to make sure it's attached. You need to make sure you know about it. What are the terms and termination? Is this a 3-year, 4-year? Is this an evergreen? Do you have to give 12 months notice, 30 days notice, 90 days notice? All of those things. Can they just come in and give you 2 weeks, but you have to give them 90 days? What are those particular areas? What are the record-keeping requirements? What are the audits? Are there internal audits? How do they handle external audits? All of these are questions that are really important just for good business practices, simply good business practices, but also certainly end up protecting you as well. As I said, it's advisable to consult an attorney before you sign. It considered an investment. Much like when you chose certain things for your waiting room, you invested in certain kinds of furniture, you invested in an intercom system, you invested in a phone service. Investing in attorney services to help you understand what you're signing up for is well worth the investment. You can take me out to lunch tomorrow. So I'm serious, it really is very important. Serious about that lunch too. And then you really want to keep a copy of the contract. Keep a copy. I know that's almost like, well, why is she saying that? Well, maybe I need to add the other part, and remember where you put it. Because you may have to pull that out. And again, I would hope this would never happen to you, but if you have to go back to the original source for a copy of your contract, you have nothing to compare it to ensure that it is exactly the same contract. And so it's just really good, again, business sense. So let's just talk for a minute. I'm not going to go into depth about hold harmless agreements, but I just want to raise your awareness, and I think Kevin may address this a little bit later. If not, we'll be available to answer questions afterwards. But hold harmless contracts our contract provisions, they state that if a company is sued by a patient or a client for the provider's actions, the provider will indemnify the whole company. You don't want to sign that, because your malpractice coverage is probably not going to cover everybody else in that company. It's going to cover you, but it's not going to cover everybody else. And if you didn't do anything, why should you pay for coverage for everybody else? So that's a critical piece. So do not sign an agreement that makes you responsible for the actions of anyone else but you, or your employees if you're the employer. Certainly you need to be responsible for them. Really important. And you might say, well, I didn't even know what hold harmless meant. Well, again, that's why you need to ask somebody. It's important for you to know what it means, because that would have big consequences for you. Certainly, I cannot stand up here wearing the hat that I wear and not talk about the ethical code. We talked about competence, and so just in case you needed to make sure that I didn't make that up, the APA Ethics Code 2.01 talks about competence. And I referred a little while ago, if you are going to be assigned cases or taking on cases you don't have any expertise with, it is your responsibility, not the practice's responsibility that you're in, to make sure you're competent. I would refer you also to, and this is in the references, the citation for the work by Susan McDaniel et al. On looking at competency areas for psychology practice. They cover a lot. It's an excellent article. It was published in 2014. And it'll help you to determine what skill set areas do you need to fulfill in order to be competent in what it is you're taking on. And certainly informed consent. I know that you hear that an awful lot. And I guess what I would want you to think about is, how would you explain informed consent to someone that asks you about it? There are a lot of times when I think we fall into this trap of, oh yeah, I know about informed consent. And you think that because you have somebody sign a consent to treatment form, you're covered. You're not. When you're talking about alternative practice models, it's really important for you to be able to explain and inform to your clients and patients who else is going to see their record. Because the alternative practice model, the company, the agency, the group may want to do quality assurance on your records. Well, that means somebody else is looking at it. So have you properly informed your patients? I think that's really important because it relates to confidentiality. So a typical comment might be something like, we will share your information as allowed by law to provide your care for payment and for our health care operations. We may share information with other health care providers involved in your care. It's just covering the bases. It's informing them so they can consent to doing that in a way that protects them and certainly protects you. So, I got to talk fast. Connie's sneaking up. She's going to show me a notice, and boy, I tell you what, yeah, thank you. I do appreciate it, actually. Documentation. If there's one thing that risk management focuses on, it's document, 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 and consult, consult, consult. So documentation is important. Where it applies to an alternative practice model is, what are the expectations that they have of you for documenting? They may have rules. You work for a hospital, they have rules. You work for a clinic or an agency, they have rules and guidelines. What are those requirements by the institution? What are the state law requirements? What are the contractual agreements? And then, of course, what are APA's record-keeping guidelines? When we are involved with other professionals, including information that facilitates their appropriate care of your patient, and they're providing information that helps facilitate your appropriate care, is very important. So documentation is critical to that. All right, so then, of course, you have to think about, what if I disagree with the people that I'm with? What do I do? Well, certainly it's important for you to try to protect the welfare of your patients. You need to document your actions, and Ethics Code 1.03 addresses this very clearly. I won't read it to you. Okay. What about, I'll talk about one more thing. Remember that you must follow the advertising and the ethics code regarding how things are marketed. It's nice to have somebody else do ads for you. You're still responsible for what it says. You can't delegate that to another agency. You are still responsible. That's what the ethics code says of APA, and so it's important for you to know about that. Okay, so we'll go to tips to remember. Understand your role in any new business model. Review all business contracts and agreements. Review your informed consent and descriptions of your practice. The Trust has on its website some suggested language for informed consent and alternative practice models. Understand the limits to patient confidentiality. Protect yourself and your patients when you're making changes to the way that you practice. And focus on patient welfare is always a good guiding principle, and I bet I still have a minute left. Thank you very much.